Okay, so now I want to talk about fetal heart rate acceleration. So this is going to be a short segment because I want to make sure and separate decelerations. So fetal heart rate accelerations are a reassuring, expected sign. We want to see a visible increase in the fetal heart rate above the baseline. It needs to go at least 15 beats per minute above baseline, last at least 15 seconds. Sometimes we will see fetal heart rate acceleration with fetal movement, with some external stimulus, some noise. They can be spontaneous. We may see them with contractions early in labor. If we don't see them, sometimes we can do some things to try to cause them to happen, to see if we can get an acceleration out of that baby, because accelerations are a sign that the fetus has the ability to respond to something by raising their heart rate and return to baseline. Okay, a very stressed fetus does not have the ability to respond to stimulus. So there are a couple of ways that we might try to elicit an acceleration. Sometimes that might be done with fetal scalp stimulation. So during a vaginal exam, the examiner might try to tickle the baby's head a little bit and see if there's an acceleration. There is a device called a Vibro Acoustic Stimulator, and it's placed against the fundus, and when it's activated, it buzzes and vibrates loudly. And that is going to get a reaction out of the fetus if they're able to do so. If we stimulate that fetus and get no response with either touch or like touching the head or the vibroacoustic stimulator, then that's a potential sign of distress. Sometimes when we do one of those things, it startles the fetus, and instead of having an acceleration, if they're not able to do that, to respond that way, it may actually cause a deceleration, which is an indicator of it's not a reassuring sign. It's considered non-reassuring. So let's look at what accelerations would look like. So we have a fetal heart rate baseline of about 135 with moderate variability. And right here at the beginning of this little strip, we have two accelerations above the baseline. Okay, they go up. This one lasts 15 seconds. From beginning to end about 15 seconds, and it goes up about 20. This one lasts a good 30 seconds. So these are accelerations, and we want to see that. Now, what happens if an acceleration goes up and then it just stays up in that new range? We may have an extended acceleration where they're just really excited, and we see that a lot again with those beta adrenergic agonists that might be given in preterm labor. But sometimes the fetus actually settles out at that new baseline, which can indicate stress. So if we have an extended acceleration, that's something we would need to watch. Does it come back down, or is it a baseline change? Okay, next we're going to start talking about decelerations.